Hello everyone, welcome back to another recall session. So today we're going to discuss with you about the anatomy recall questions of INI-CET, which is conducted in May and November 2021. So let us start discussing the questions. A 6-month-old boy was brought to the casualty with seizures. The pediatrician tries to do CSF sampling. What are the structures punctured by the pediatrician while piercing through the marked structure? This marked structure is anterior fontanelle, and the structure pierced by when you pierce the anterior fontanelle is scalp, dura, and arachnoid. So the answer here is A. Scalp, dura, and arachnoid. The next question is a 12-year-old presented with fever and difficulty swallowing. He had swelling in the marked region and was advised to undergo surgery. Post-surgery, the gauze continued to soak with blood. Which of the following vessels must have been injured? The option is tonsillar branch of facial artery, ascending pharyngeal artery, paratonsillar vein, and retromandibular vein. The marked structure here is tonsil, and this is the case of acute tonsillitis. So the most probable structure here injured is paratonsillar vein during tonsillectomy. Okay, so let us move on to the next question. At which level does the nerve supply for the marked structure arise? The options are red nucleus, subthalamic nuclei, decussation of the pyramidal tract, and olivary nucleus. So the marked structure here is medial rectus, which is supplied by oculomotor nerve, nucleus of which is situated at superior colliculus, which is close to red nucleus. So the answer here is A, red nucleus. The next question is which of the following are branches of the anterior division of internal iliac artery? So this is the question about the vascular supply. Talking about the branches, and different divisions, that anterior and posterior divisions that they are asking. They are specifically asking about the branches of the anterior division of the internal iliac artery. So to answer this kind of question, we have to know the exact anatomy of internal iliac vascular supply, and to know that, we have to know the exact figure of that internal iliac artery. So this is the internal iliac artery. So the branches from the anterior division of internal iliac artery are obturator artery, superior vesical artery, inferior vesical artery, middle rectal artery, internal pudendal artery, and inferior gluteal artery. And the branches of posterior trunk or posterior division of internal iliac artery is lateral sacral artery, superior gluteal artery, and iliolumbar artery. Let us repeat this again. Branches of anterior trunk of internal iliac artery is obturator artery, superior vesical artery, inferior vesical artery, inferior gluteal artery, middle rectal artery. In female, there is vaginal artery is the branch, and uterine artery is also the branch, and internal pudendal artery. And branches of the posterior trunk of the internal iliac artery is iliolumbar artery, lateral sacral artery, and superior gluteal artery. So superior gluteal artery is the branch of posterior division of internal iliac artery. Inferior gluteal artery, superior vesical artery, middle rectal artery, inferior vesical artery, and vaginal artery. These all are the branches of the anterior division of internal iliac artery. So the answer is C. The next question is, fibers from the marked structure terminate at which of the following? So this marked structure is superior cerebellar peduncle, and the fiber from superior cerebellar peduncle terminates at red nucleus, thalamus, and brainstem. So this fiber from this marked structure terminate at red nucleus, because this is given in the option. Other two structures are the thalamus and the brainstem. Let us move on to the next question. A woman with right-sided loss of sensations of both upper and lower limb complains of shooting pain from her fingers to the right shoulder and a burning sensation when touching cold water. Motor functions are normal. Which of the following structures is likely to be involved? Let us label these all structures. This A is chordate nucleus, the B is thalamus, the C is subthalamic nuclei, and the D marked here is pons. The clinical scenario that is given in the question is right-sided loss of sensation of both upper and lower limb, and complaints of shooting pain from her fingers to the right shoulder, and a burning sensation when touching the cold water. This is actually describing the scenario of thalamic pain syndrome. It is also known as Dejerine Roussey syndrome. So the structure that is affected in this condition is B, that is thalamus. Now move on to the next question. 25-year-old male presented with symptoms of inability to flex the distal interphalangeal joint of the fourth and fifth digits. He was not able to hold a piece of paper between his fingers. What is the likely site of injury? So let us label these all four alphabets, which are marked here. This D is the head of humerus. The A is shaft of humerus. This one is the medial epicondyle. This one is the lateral epicondyle. This scenario is talking about inability to flex the distal interphalangeal joint of the fourth and fifth digits, and also not able to hold a piece of paper between his fingers. So this scenario is talking about actually the ulnar nerve injury, because CAR test is positive, and is also inability to flex the distal interphalangeal joint of the fourth and fifth digits. This is suggestive of ulnar nerve injury, and this ulnar nerve passes from the medial epicondyle of the humerus, and the answer here is C. The next question is: a young child with absent is brought to the OPD with features of hypoparathyroidism and tetani. Which of the following marked area in the picture is defective in this condition? So there is a clinical scenario suggestive of absent thymus, hypoparathyroidism, and tetani. This figure is showing pharyngeal pouches, and there is also one thing that is present is absent thymus. So Hypoparathyroidism means there is a defective parathyroid gland. So parathyroid gland develops from third and fourth pharyngeal pouches. But there is a clearly suggestive this clinical scenario is there is absent thymus. So thymus develops from third pharyngeal pouch. So the answer is 3. C is the answer. The next question is a patient who has taken the first COVID vaccine comes for the second dose. An estate nurse noticed that the shoulder was flabby, flat, and was asymmetrical. There was an associated loss of contour of the shoulder joint. Injury to which of the following structure might have resulted and was avoidable? So, shoulder was flabby, flat, and was asymmetrical. And there was an associated loss of the contour of the shoulder joint. So, there is a deltoid muscle is completely injured, and that is due to axillary nerve injury, which has happened, and that was avoidable. So, injury to the axillary nerve that happened, and that was avoidable. So, the D is the answer. The next question is the parasagittal section of the abdomen is given below. What is the superior border of the marked structure? So, this marked structure is epiploic foramen, and the superior border of that marked structure is caudate lobe of liver. So, the answer here is A, caudate lobe of liver. The next question is through which of the following marked sites does SARS-CoV-19 spread to the brain? So infection of SARS-CoV-19 happens through the cribriform plate of skull bone. From there, it spreads to the brain through olfactory bulb. So the site that is marked as A suggestive of cribriform plate. So the answer here is D. A is the cribriform plate. The next question is a boy with a history of a fall from a tree presents with a lurching gait and dragging of his feet. Which of the following structures are involved? So 1, 2, 3, and 4. These all are the structures. So the one is suggestive of gluteus maximus. The number 2 is gluteus medius. The number 3 is piriformis. And the number 4 is sciatic nerve. So the structure that is injured here is due to injury to the gluteus medius, and the structure marked as gluteus medius is number 2 because there is injury to the hip muscles which are responsible for the elevation of opposite side by the supported side that happens during the walking, that mostly happens due to the injury to the gluteus medius and gluteus minimus. So the mark structure 2, number 2 is gluteus medius and that is injured. So the option marked as B, suggestive of number 2, that is the answer. The next question is, a patient after a road traffic accident presents to the emergency room with difficulty in swallowing and slurred speech. Investigations reveal fractures in the occipitotemporal region. Which of the following areas should be tested in order to find the nerve which is involved? This scenario is suggestive of difficulty in swallowing and slurred speech, and suggestive of fractures in the occipitotemporal region. So this scenario is actually suggestive of ninth and 10th cranial nerve injury, and that is due to the fracture in the occipitotemporal region. So the 10th cranial nerve here is supplying the palate and uvula. That is marked as number 2 in the given image. So that is the most probable injured structure in this scenario. So the nerve that most probably injured in this scenario is ninth and 10th cranial nerve, and to diagnose that easily, you can measure the taste sensation of the uvula, and then you can easily diagnose the clinical the nerve injury. So the answer here is B, number 2. The next question is, the fiber from the marked structure end in which of the following areas of the thalamus? This marked structure is mammillary body, and mammillary body actually ends in the anterior nucleus of thalamus. So the answer here is C, that is anterior nucleus of thalamus. So the next question is, the cell marked in the below slide is inhibitory too. So the cell marked here is Purkinje cells, that is inhibitory to the deep nuclei of cerebellum. Let us move on to the next question. The marked structure develops from which of the following structures? This is the marked structure. This is the marking of azygous vein, and that arises from the supracardinal veins. So the next question is inferior thyroid artery supplies which of the following structures? The four structures are given in the question: thyroid, parathyroid, esophagus, and thymus. All of the following structures are supplied by inferior thyroid artery. That thyroid and parathyroid are supplied by inferior thyroid artery, as well as inferior thyroid artery gives esophageal and thymic branches. So that all the structures supplied by inferior thyroid artery, and the answer is A. 1, 2, 3, and 4. The next question is which part of this bone is palpable in the infraclavicular fossa? So let us label first of all these all four parts. So the first one is coracoid process. The second one is acromion process. The third one is glenoid cavity. And the fourth one is inferior angle. The answer is 1, that is the coracoid process, because coracoid process is the process which is palpable through the infraclavicular fossa. The next question is identify the pelvic diaphragm in the picture given below. So let us label first of all this diagram. The first one is pelvic diaphragm. The second structure is external anal sphincter. The third structure is internal anal sphincter. And the fourth one is pudendal canal, which gives the space to pass out the pudendal vessels and pudendal nerve. So the pelvic diaphragm in the picture given below is number 1. That is the A is the answer. The next question is identify the incorrect match. So let us first of all label these all four markings. The first one is cilia. The second one is goblet cells. The third one is nuclei of epithelial cell. And the fourth one is basement membrane. So the cilia is correct, goblet cell is correct, nuclei of epithelial cell is correct, but the lamina propria is wrong. So the answer is B. Third part of vertebral artery is related to which of the following? So there are four marked structure in this diagram of vertebrae. So this given structure is first cervical vertebrae, that is atlas. So let us label these all four structures 1, 2, 3, and 4. The one is posterior tubercle. The second one is posterior arch. The third one is superior surface of articular facet. The fourth one is posterior surface of anterior arch. So the third part of vertebral artery is related with the posterior arch of the first cervical vertebrae, that is atlas. So the answer here is C, number 2. What is the most common complication of the central line insertion below the marked bone? The options are arterial puncture, thrombophlebitis, empyema, and chylothorax. So this marked bone is clavicle, and inferior surface of clavicle you insert a central line. So most common complication of central line insertion is arterial puncture. The answer is A. The next question is identify the cranial nerve passing through the given structure. The structure marked the dorsal aspect of brainstem, and the cranial nerve passes through the dorsal aspect of brainstem is trochlear nerve, that is the fourth cranial nerve. So the answer here is C, fourth cranial nerve. So with this, we complete our recall session of INI-CET 2021. So thank you so much for watching and see you in the next one.